healthcare for undocumented immigrants. And I want to specify specifically for people who come across the border,
legitimately proceeding through the asylum or residency process. They have been identified. They're still considered undocumented. Many times they have work permits. They are paying taxes.
should those folks have access to medi-cal and free healthcare in California?
Of course, everyone, it's a human right. I agree with that. Everyone should have access to healthcare. We're not a barbaric society, right? Other states do it in a much more limited way, not in this gold-plated way that we do here in California. So I don't think there's any excuse, because what is that really? That $12 billion of spending, that is basically a subsidy to big business so that they can employ illegal immigrant workers and not pay their health care because the taxpayer is going to bail them out. I think that's totally unacceptable.
As a business guy, I've spoken with one candidate, at least, might have been two, who is very interested in single-payer healthcare. So free healthcare for everyone in California. And he says it will bring more businesses back to California because that is businesses' highest expense is healthcare for their workers. So if they think that they don't have to pay for healthcare in California, of course they're going to move their company here because that's a massive savings. What do you think about that as a businessman?
It's interesting because you've got to look at the whole picture. So I agree with the point that this shouldn't be a burden on businesses. But of course, who's going to pay for that single pay? That's a massive tax. Look, I was in the UK government. We have the National Health Service in the UK, and that is single payer. It's a massive component of the budget. It's a nightmare, massive bureaucracy. People are very unhappy with a lot of the outcomes. The outcomes are much worse. I nearly died as a result of the failings of a single payer healthcare system. The idea that single-payer healthcare is some perfect nirvana is just absolutely not true.
Healthcare for undocumented immigrants, and I want to specify people who come across the border at a legitimate crossing, legitimately proceeding through the asylum or residency process, should they be allowed access to medi-cal and healthcare in California?
That's a tough question because it's the argument is they're not here legally. But I get the argument that they are here legally because they came across, they were given the papers and everything else. And so that would make them apply. As the way the current law states, they do fit in there.
As governor, would you allow them to continue to get that while they're waiting and they are going through the process?
I would make sure that if they were, they had to be working.
So I believe we have stopped accepting people onto the undocumented people onto the medi-cal rolls for now. But I believe that people who are here, undocumented people who are here working, paying taxes, being members of society, are entitled to those benefits. For these people, they're not being accepted, and that's where we are now, and that seems appropriate given our financial situation.
Okay. Should they be allowed to have access to medi-cal and free healthcare?
People who have green cards, yes.
They're not green cards. People who...
Asylees, people who are applying for asylum.
Who are in the process of.
Yes, I think that's appropriate. Look, we all do better when we are all healthier, our communities being healthy. I hope the pandemic taught us that it's not enough that one of us is healthy. We want the whole community to be healthy. And let's be honest, California has an ugly history of trying to deny health care to immigrants with Prop 187. I think we changed course on that for a good reason.
Should those folks have access to medi-cal?
So people who are legally coming into the country, the laws are pretty clear already, and they have access to care already. Donald Trump is scaring everyone, including those who have a legal right to access health care. And that's the unfortunate part, because a lot of folks aren't sending their children in to get care because they're so afraid. That's wrong, and we will not permit that in California.
Before they are officially documented.
Yeah, if we want to fix our immigration system, let's fix our immigration system. Let's not punish people by withholding health care. And the reality is when we make it harder for people to get care earlier, particularly preventative care, you end up with people showing up at emergency rooms in dire situations who must be treated because a doctor has a duty to save human lives. That's more costly, it's inhumane, it's not reflective of California values. Let's separate these things and not punish people by trying to withhold healthcare, a fundamental need that we all have. Let's not make people sicker. It also is, it's so short-sighted to do this. I think it's cruel, and it you know what it means is it's actually going to mean people are less likely to be able to work because they'll have more chronic illness. It means more people will fall into homelessness. It's going to end up being more expensive in the long run to not get people the health care they need. At the same time, let's fix our immigration system. Let's have lawful immigration and pathways to legal status. Let's secure the border. There is a broader fix on immigration that we should talk about and be focused on. It's going to require both parties to compromise to do it, and we should all hold them accountable for fixing it. Let's not try to tie healthcare for somebody, which I view is essentially a fundamental need and right for people, to this other political issues. I have no patience for these kind of gimmicky political issues that actually hurt vulnerable people.
Should they be allowed to access medi-cal and healthcare in California if they are undocumented, but they did come across at a legitimate crossing and are in the process?
Well, first of all, what I've said with respect to this issue is we already provide health care to those people. It's called emergency health care. And over the course of time, we spend more on emergency health care for those folks than we would if we were spending on medi-cal and preventative care.
In other words, if they went into an emergency room, we have to cover them.
We have to cover them anyway. And oftentimes, it's because they've waited so long without preventative care that their condition is so extreme that it required them to go to an emergency hospital. That's one. So we already pay for it over the long term. Two, just before we sat down, you talked about the pandemic. The pandemic didn't say you're undocumented and you're documented. The pandemic was real, and it swept through this entire country. And so what I tell people, healthcare's a right, and what we already spend that amount. So there's a health policy reason for it, and there's also an economic reason for it. We're already spending that money, and these people are just getting sicker. And given the pandemic, it just makes sense.
Should those folks be allowed to have access to medi-cal and free healthcare in California?
I do believe they should be able to access a basic level of healthcare in California. I think we can debate what that level should be, but my fear, Julie, is that if we should have a public health pandemic or just some other public health emergency, what would happen when we have this population and this community here in California and not receiving healthcare? So I think from a public health perspective, I would say, yes, we should fund some basic level of healthcare for them. Yes.
Should they be allowed to have access to medi-cal and healthcare in California?
To be clear, I support healthcare for all, including undocumented immigrants. I voted for it as a legislator. I would support it as a governor. And for one simple reason, no matter how you feel about it, you cannot deny the cost to our systems when people without insurance go to an emergency room to get care. And I think we have to find a way to reverse some of the trends of the big, beautiful bill that's going to knock millions of Americans off of the Medicaid rolls to protect Medi-cal. Medi-cal is a federal entitlement that we can use to support children and their families who have a health need or a mental health need. And I think it's incumbent on us to address those needs, and if nothing else, to protect the public dollar so that people aren't paying more for services that get rendered in the emergency room. So I support Medi-cal and health care for undocumented individuals for those reasons.